Right. Have you all done this material? Hmm? And as I already promised, yes, this is an exam model material for part B. So the sample question will definitely help you to, improve your skills regarding part B. Plus, by the end of the session, you will be able to know what you will feel. Yes, confident, and you are like confident. Yes, I can do this material. And yes, so let's dive into this material, and let's answer the question together. So I'm going to read the question. So likewise, you can read the question, then underline the keywords from the question. Just read the options and read the paragraph, find out the answer. Okay, so what is the main focus of the updates to the medication administration policy? And when you read the question, you will get confused whether it is a policy or an email, because in the paragraph it just look like an email or a memo, because there is a sender mentioned, a receiver is here. So likewise, sender and receivers are mentioned, already mentioned in this text. So definitely you will get confused whether it is a policy, because it is a policy like question mentioned in the question. So let me know in the comment box whether this question is from the first category, second category, or third category. Let me know in the comment box, please, whether this question is from the first category, second category, or third category. I'll read the question once again. What is the main focus of the updates to the medication administration policy? That is the question. So my keywords, I'll just underline the keywords from the question. So by that time, you can just comment it here. What are the, which category of question is this, right? So my keywords, main, focus, and updates. These are my keywords from the question. All right. So here in the question, they are asking what is the main focus. What is important here? So maybe everything is important here, but the question is asking what is the main focus? What is more important here? What is something crucial or critical? So that is they're asking here. And after reading the question, let's connect with the options. Then you will understand after reading the paragraph whether it is a policy or an email or whatever. Then let's decide which category. So this is all about updations or updates to medication administration policy. So I think from this text as well as from the question, this is a policy they are sending, updation or changes that has happened to the policy, and they are sending to all the staff in the hospital regarding, okay, what are the changes they have already given in this policy, and this is like an information to them. Okay, അവർക്കൊരു ഇൻഫർമേഷൻ പാസ് ചെയ്യാണ് ഇതൊക്കെയാണ് വന്ന മാറ്റങ്ങൾ എവിടെ ഇൻ ദ പോളിസി ത്രൂ ആൻ ഇമെയിൽ. ഒരു ഇമെയിൽ കൂടെ അവരത് സെൻഡ് ചെയ്യുവാണ്. ദേ ആർ ജസ്റ്റ് ഗിവിങ് എൻ ഇൻഫർമേഷൻ. സോ ഐ തിങ്ക് ലെറ്റ്സ് റീഡ് ദ ഓപ്ഷൻസ് ഹിയർ. Option A, to reduce the administrative burden on nursing staff by streamlining training procedures. So my keywords, reduce, administrative, which means whatever the things they are doing, a burden on nursing staff by streamlining training procedures. Streamlining, which means making it easier for them. Their procedures are getting easier. That is streamlining. That easy ആക്കി മാറ്റുക എന്നുള്ളത്. Then option B, to align the hospital's practices with the regulatory standards and improve record keeping. So my keywords, align, then regulatory, record keeping. Okay, so to make a proper strategy or a structure for record keeping, that is option B. That is why they are just mentioning about this particular policy. And option C, to enhance patient safety by implementing additional precautions for high alert medications. So my keywords, enhance, then implementing, high alert. That is all about high alert medications. By the way, I'm underlining the keyword high alert. So here, those are the keywords from the question. So already, as I mentioned earlier, when you read a question from part B, the first step is reading the question. നമ്മൾ ആദ്യം question വായിക്കുന്നു. The second step, we should underline the keywords from the question. നമ്മൾ keywords underline ചെയ്യുന്നു because those keywords can help you to find out the answer. And third thing is understand the question. That means whether it is from which category, first category ആണോ, second category ആണോ, third category ആണോ. So likewise, you are understanding the question. Then we are reading the options. Options കൃത്യമായിട്ട് വായിക്കുക. Then underline the keywords from the options. And one more important thing, I'm just giving you a reminder, guys. When you underline keywords from the question, it shouldn't be more than 3. 3 keywords കൂടുതൽ നമ്മൾ underline ചെയ്യരുത്. Why? Because when you underline more than keywords, 3 keywords, it will be, confusing for us. All right, so that's that. Then the next one is read the passage. Passage clear ആയിട്ട് വായിക്കണം. Don't skip any line. ഒരു ലൈൻ പോലും നമ്മൾ സ്കിപ്പ് ചെയ്യരുത്. Each and every line is important and read the passage. And the strategy in the initial time, I mean, when I begin the session, I already mentioned we were discussing about the strategy today. So the strategy or the method we are applying in part B, that's called elimination method. That is the only method which will help you to find out the right answer. Okay, വേറെ ഒരു മെത്തേഡ് നമുക്ക് അപ്ലൈ ചെയ്യാൻ പറ്റില്ല ബിക്കോസ് ആസ് പെർ ദ നോളജ് ദാറ്റ് വി ഹാവ് വെൻ യു റീഡ് സംതിങ് യു ഹാവ് എൻ ഐഡിയ ഓക്കെ മേ ബി ദിസ് ഇസ് ദി ആൻസർ ബട്ട് ദിസ് ഇസ് നോട്ട് അബൌട്ട് ക്വസ്റ്റ്യൻ ആൻസർ സെഷൻസ് ഇതൊരു ക്വസ്റ്റ്യനും ആൻസർ കണ്ടുപിടിക്കാനുള്ള ഒരു സെഷൻ അല്ല ദിസ് ഇസ് ഓൾ അബൌട്ട് മൾട്ടിപ്പിൾ ചോയ്സ് ക്വസ്റ്റ്യൻസ് വിത്ത് 3 ആൻസർ ഓപ്ഷൻസ് നമുക്ക് ഒരു ആൻസർ അല്ല ഉള്ളത് വി ഹാവ് 3 ആൻസർ ഓപ്ഷൻസ് സോ ദർ ആർ സിറ്റുവേഷൻസ് ഓർ ദർ ആർ ടൈംസ് ദാറ്റ് യു വിൽ ഗെറ്റ് കൺഫ്യൂസ്ഡ് അപ്പോൾ ഇതിൽ ഏതായിരിക്കും whether it is option A, B, C or D. So likewise you will get confused. So the best thing you can do, eliminate. Okay, after reading the paragraph, along with reading the paragraph, you should eliminate certain options. That will be much more better. Yes. Hi Deepa. Hi Santwana, good evening. Yes, Linza, good evening. Happy New Year, guys. Yes. I think this is our second live session, right? Yes. Okay. So I'm going to read the paragraph, then we will discuss the answer. So, Director of Nursing. So, this is an email from Director of Nursing to all staff. ഇത് ആർക്ക് അയക്കുന്ന മെയിലാണ് to all the staff. Subject, and you know that if it is an email, subject line is very important. അല്ലേ subject line എന്ന് പറഞ്ഞാൽ എന്താണ്? What is subject line? Subject line which indicates the summary of the email's content. ആ ഇമെയിലിൻ്റെ content എന്താണോ അതിൻ്റെ summary ആയിരിക്കും, that will be in the subject line. So, subject line is very important. Dear team, I hope this email finds you well. As part of an ongoing commitment to patient safety and compliance with regulatory standards, we are implementing updates to our medication administration policy. So just, just mentioning about, okay, we will update it. These changes are effective from next Monday. All nursing staff are required to complete a training module on the updated policy, which will be available online via the hospital's learning management system, that is LMS, from tomorrow. You will need to complete the module and pass the associated assessment by the end of the next week. Certificates of completion will be automatically recorded in your professional file. Please note that compliance with this training is mandatory and failure to complete it by the deadline may result in administrative follow-up. That is all about the first para. While reading the first para, as a normal reader, what you will think, namak endu thonum? Everything is important. And what is the summary of the first para? ഇവിടെ ഫസ്റ്റ് പാരയിൽ കൊടുത്തിരിക്കുന്ന സമ്മറി എന്താണ്? There is a kind of policy, ഇങ്ങനെ ഒരു പോളിസി ഉണ്ട് and everybody should follow that, and certificates are important. So അതൊക്കെയാണ് ഇവർ പറയുന്നത്. So compliance, which means you should follow everything correctly or comply with that. Then a critical addition. So I think this is the keyword from the question, critical addition. That means main focus of the update. എന്താണ് അവരവിടെ ഇമ്പോർട്ടൻ്റ് ആയിട്ട് ആഡ് ചെയ്യുന്നത്? ക്രിട്ടിക്കൽ, which means something very important. So what they're actually adding here, which is something important. So a critical addition to the policy involves a mandatory double check procedure for all high alert medications, including insulin, anticoagulants and opioids. So from that particular line, I am just tracing my answer towards option C. Why option C? എന്തുകൊണ്ട് നമ്മൾ ഓപ്ഷൻ സി അങ്ങോട്ട് ഫോക്കസ് ചെയ്തു? To enhance patient safety by implementing additional precautions for high alert medications. And I can see a lot of high alert medications mentioned here. That is the first reason. And second reason, enhance patient safety. See, if you are providing some information regarding high alert medications, definitely it is for the safety of the patient, right? Yeah, for sure. By implementing additional precautions. So here, very clearly they've mentioned a critical addition, additional precautions. Okay, so critical addition to the policy involves a mandatory double check procedure for all high alert medications and including these kind of medications mentioned here. Then this step is being implemented to strengthen compliance with safety regulations and most importantly to reduce the risk of errors. Why it is important? To reduce the risk of errors, and through reducing the risk of errors it is getting benefit to the patient, safety of the patient. Should you medication administration, we trust that these measures will improve patient care and safety. Again, option C. Kanda. Should you have any questions or concerns regarding these updates, please feel free to contact your line manager or the quality and safety team directly. Thank you for your attention to this matter, for your continued dedication to patient safety. Best regards, Director of Nursing. So that's all about the email. So simply what I understood from the passages, they are just focusing on option C here. That is the main focus. Okay, and what about you guys? Your answers, let me know your answers please in the comment box. What is your answer? എന്തൊക്കെയാണ് നിങ്ങളുടെ ആൻസേഴ്സ് പറയുന്നത്? Yes, Fasila. Yes, Neethu, Sudha. Good evening, everyone. So what is your answer, please? Let me know in the comment box. Whether it is A, B or C. Yes, Fasila, what is your answer? ഏതാണ് ആൻസർ കിട്ടിയത്? A ആണോ, B ആണോ, C ആണോ? A, which means to reduce the administrative burden on nursing staff. So, simply we can eliminate option A because it is simply not mentioned in the passage. എവിടെയാണ് കൊടുത്തിരിക്കുന്നത്? ഈ പോളിസി വഴി they are just, meaning reducing the administrative burden of nursing staff. ഇതുവഴി nursing staffന്റെ burden കുറയ്ക്കുന്നു എന്ന്. Simply not mentioned anywhere. What about option B? To align the hospital's practices with regulatory standards and improved record keeping. And the same reason I'm eliminating option B, I think it's not mentioned anywhere in the para, like record keeping or anything. So, simply answer is option C. To enhance patient safety by implementing additional precautions for high alert medications. And I'm saying, please trust me, definitely they can ask you this kind of a question in your exam. You can expect this kind of an email in your exam. Okay, so once again I'm repeating, read the question, underline the keywords, then understand the question, whether it is an email, policy, guideline, memo, or whatever it is. Please do understand which category and what are you reading for in the category. For example, this is an email. This is email aanale. So what are you reading for in an email? Nammal endinu vendiya vaayikkunne? We are reading for the purpose. Okay, we are reading an email for the purpose, the overall idea. Subject line is very important in an email. Subject line eppudu important aanu. Okay, then what is next? We are always focusing, each and every line is important, by the way. We can, just give a little bit more focus to the last para or last lines. Okay, last line la answer undavumne orikkalum njan paraya. I will not say the answer will be in the last line, but you should focus on the last para or last lines. All right, so answer is option C. I hope it is clear for you. So yes, what is your answer, guys? Let me know in the comment box what are your answers. Yes, Vishnu. Hi, Vishnu. Option is C. Very good, Vishnu. That is the right answer. Yes, Jarina, which is C. Very good, dear. Yes, Sudha, Deepa, Fazila, Neethu, answer is C. Very good, very good. Okay, excellent. And yes, Vishnu, option A and option B not mentioned. പക്ഷെ നമ്മൾ വായിക്കുമ്പോൾ when you read the paragraph, it is not that much, direct paragraph. അങ്ങനെ direct answer കിട്ടുന്ന ഒരു paragraph അല്ല. So definitely we have a confusion that, okay, is it option A or B? അങ്ങനത്തെ ഒരു confusion വരും. അല്ലേ? But that is why we are applying elimination method here, so it is very simple to understand. Okay, so let's dive into the next one, the most important topic which we have today. And when I talk about this particular material, this is not a very easy one, I would say, not a very tough one, but an average material. And you can expect this kind of a material in your exam as well. So every day as a reader, if it is reading is difficult for you, what I would suggest is that please do an additional material every day. നമ്മൾ എല്ലാ ദിവസവും അഡീഷണൽ മെറ്റീരിയൽ ഒരെണ്ണം ചെയ്തിരിക്കണം. ദാറ്റ് ഇസ് കമ്പൾസറി ഇഫ് യു വോണ്ട് ടു റിയലി പാസ് ദിസ് എക്സാം. പ്ലസ് ഐ ജസ്റ്റ് വോണ്ട് ടു ടെൽ യു സംതിങ് മോർ. എന്തിനെ പറ്റിയാ? അതായത് വാട്ട് ഇറ്റ്സ് ഓൾ അബൌട്ട് പ്രാക്ടീസ് മെറ്റീരിയൽസ്. ഇപ്പം when I ask my students, ഞാൻ എൻ്റെ സ്റ്റുഡൻസിനോട് ചോദിക്കുമ്പോൾ they will say, okay ma'am, we have already done this material. When I say about something, I mean, okay, നിങ്ങൾ ഈ മെറ്റീരിയൽ ചെയ്തിട്ടുണ്ടോ? They will say, we have already done this material. And I would say, okay, then you can score 42 out of 42 next time. Okay, ഞാനിപ്പോൾ ഒരു മെറ്റീരിയൽ തന്നാൽ അപ്പോൾ നിങ്ങൾക്ക് 42 out of 42 മേടിക്കാമല്ലോ. ഇഫ് യു ഓൾറെഡി ഡൺ ദിസ് മെറ്റീരിയൽ നിങ്ങൾ ഇതിന് മുമ്പ് ചെയ്തിട്ടുണ്ടെങ്കിൽ നിങ്ങൾക്ക് 42 out of 42 മേടിക്കാം. Am I right? And they will be like, no ma'am. Okay, they are not confident. So why? And I will say them, reading and listening is not about how many materials we have done. നമ്മൾ എത്ര മെറ്റീരിയൽ ചെയ്തു എന്നുള്ളതിലല്ല. Okay, maybe you have done 1000 materials. നിങ്ങൾ ചിലപ്പോൾ 1000 മെറ്റീരിയൽ ചെയ്തിട്ടുണ്ടാവും. But there is no connection with your mark ആൻഡ് ദ നമ്പർ ഓഫ് മെറ്റീരിയൽസ് വിച്ച് യു ഹാവ് ഡൺ. നിങ്ങൾ ചെയ്ത മെറ്റീരിയലും നിങ്ങളുടെ മാർക്കും തമ്മിൽ ഒരു കണക്ഷനും ഉണ്ടാവില്ല. ഇറ്റ്സ് ഓൾ അബൌട്ട് ദ സ്കിൽ വിച്ച് യു ഹാവ്. നിങ്ങൾക്ക് എത്രത്തോളം റീഡിംഗ് സ്കിൽ ഉണ്ടോ, you will get marks. So when I asked my student who got above 400, and she told me that, okay ma'am, I was doing the materials, same materials, repeated materials. I will just do the material whenever I get full marks. എനിക്ക് എപ്പോഴാണോ 42 out of 42 കിട്ടുന്നത് അതുവരെ ആ മെറ്റീരിയൽ ഞാൻ ചെയ്യും. ദാറ്റ് മീൻസ് ദാറ്റ് സ്റ്റുഡൻറ്റ് വാസ് ഫോക്കസിങ് ഓൺ ഹർ മിസ്റ്റേക്സ്. എനിക്ക് എവിടെ മിസ്റ്റേക്ക് വന്നു എന്നുള്ളതാണ് നമ്മൾ ഫസ്റ്റ് കണ്ടുപിടിക്കുന്നത്. ഇന്ന് ഞാനൊരു മെറ്റീരിയൽ ചെയ്തു. When I get the answer keys of the material, I know that, okay, I have done these mistakes. ഇത്രയും mistakes എനിക്ക് പറ്റി. On the very next time doing another material without even checking what are the mistakes I've done on the previous material. ഇപ്പം കഴിഞ്ഞ മെറ്റീരിയൽ എനിക്ക് എന്തൊക്കെ മിസ്റ്റേക്ക് വന്നു നോക്കുന്നില്ല. That is your mistake. Okay, so a good reader is somebody who are always checking, okay, what kind of mistakes that I've done. എനിക്ക് വന്ന മിസ്റ്റേക്ക് എവിടെയാണ് എനിക്ക് തെറ്റിയത്, അവിടെ ഞാൻ കറക്റ്റ് ചെയ്യണം. So this is how I should read there. ഇതാണ് അതിൻ്റെ മീനിങ്. ഞാൻ ഇവിടെയാണ് ഇങ്ങനെയാണ് കറക്റ്റ് ചെയ്യേണ്ടത്. Then you should identify what is your mistake there. Then only you will improve in reading. അത് മാത്രമാണ് റീഡിങ് ഇംപ്രൂവ് ചെയ്യാനുള്ള one method. The most important method, yeah, I can say. Okay, അല്ലാതെ ഞാനൊരു മെറ്റീരിയൽ ചെയ്തു ഇനി ഞാൻ പുതിയ മെറ്റീരിയലേ ചെയ്യുള്ളൂ. No, that doesn't matter. So whatever material which you have with you, just do it again. നിങ്ങൾക്ക് 42 കിട്ടുന്നുണ്ടോ? No. Then do it again. Then find out your mistakes. Identify എന്തൊക്കെ kind of mistakes that you have done there. Okay, then you will improve. That's that. So today, it's all about Legionnaires' disease. It's not Legionnaires' disease. It's not pronouncing like that. The pronunciation is entirely different. So that is Legionnaires. It's Legionnaires' disease. Okay. So have you all done this material? ഒന്ന് കമൻറ്റ് ചെയ്ത് എത്ര പേര് മെറ്റീരിയൽ ചെയ്തു. മെറ്റീരിയൽ ചെയ്തിട്ടുണ്ടെങ്കിലും ഇല്ലെങ്കിലും പ്ലീസ് ഡു അറ്റൻഡ് ദ ലൈവ് സെഷൻ കംപ്ലീറ്റ്ലി, ബിക്കോസ് ഐ വിൽ ബി ജസ്റ്റ് സേയിങ് a lot of tips and tricks in this live segment. Okay, so that's it. So today it is Legionnaires' disease. As we know, we have text A, text B, text C, as well as text D. And I'll be focusing on how you can underline keywords and what are the importance of keywords in text A, part A. Because majority of the students are not even doing, underlining the correct keywords from the question. I have no idea why. ഒരുപാട് ഞാൻ കണ്ടിട്ടുണ്ട് that students are not even marking their keywords from the question. ഒരു കീവേഡ് മാർക്ക് ചെയ്യാതെ എങ്ങനെയാണ് നമുക്ക് ആ ക്വസ്റ്റ്യൻ്റെ ആൻസർ കിട്ടുന്നത്? There is no chance. എന്നാണോ നിങ്ങൾ കീവേഡ് അണ്ടർലൈൻ ചെയ്ത് ആ കീവേഡ്സ് സെർച്ച് ചെയ്യാൻ തുടങ്ങുന്നത് in part A, then you will get the right answer. All right, clear? I hope it is clear. So please do underline the keywords from the question. Don't be overconfident. എനിക്ക് ഇത്ര സമയത്തിനുള്ളിൽ പെട്ടെന്ന് ചെയ്ത് തീർക്കാൻ പറ്റും. So at the time when I am going to underline the keywords, I will lose my time. That is your misconception. അത് നമ്മുടെ തെറ്റിദ്ധാരണയാണ്. ഞാൻ കീവേഡ് അണ്ടർലൈൻ ചെയ്യുമ്പോൾ എൻ്റെ സമയം പോകും. No, those keywords will help you to find out the answer. So please do that. Okay, എല്ലാത്തിനും ഒരു സ്ട്രക്ചർ നമ്മൾ പഠിക്കണം. നമുക്ക് തോന്നുന്ന രീതിയിൽ നമുക്ക് എന്ത് വേണമെങ്കിലും ചെയ്യാം. No problem. But it will take time. Okay, so always study from the past mistakes. അങ്ങനെയല്ലേ പറയാ, നമുക്ക് കഴിഞ്ഞു പോയ തെറ്റുകളെന്ന് വേണം നമ്മൾ പഠിക്കാൻ. Only you can study from your mistakes. മിസ്റ്റേക്സ് എന്നാണ് നമുക്ക് ലെസൺസ് കിട്ടുള്ളൂ. ഒരിക്കലും കറക്റ്റായിട്ട് പോയിക്കൊണ്ടിരിക്കുന്ന ഒരാളുടെ കയ്യിൽ ഒരു മിസ്റ്റേക്കും ഇല്ലെങ്കിൽ they will not study anything. Okay, a person who is willing to study, who is willing to improve something, they can only improve from their mistakes. അവർ തെറ്റുകളിൽ നിന്നാണ് അവർ പഠിക്കുന്നത്. മനസ്സിലായില്ലേ? അപ്പോൾ അതുകൊണ്ട് എന്താണ്, സെയിം മിസ്റ്റേക്സ് റിപ്പീറ്റ് ചെയ്യാതിരിക്കുക. ഡോണ്ട് റിപ്പീറ്റ് ദ സെയിം മിസ്റ്റേക്സ്. If a guy or if a person is repeating the same mistake, that means that person is not improving. That person is not ready to improve. അയാൾക്കത് ഇമ്പ്രൂവ് ചെയ്യേണ്ട കാര്യമില്ലെന്നല്ലേ അതിൻ്റെ അർത്ഥം. സോ പ്ലീസ് ഡു ദിസ്. എന്താണ്, I just want to change. I will not do the same mistake again. Like kind of, a thought or a kind of, ആ ഒരു ഡിസിഷൻ നമുക്ക് എടുത്തിരിക്കും. Okay. So, I think I'll just read and underline what are the keywords here. Then you will understand what are the keywords, how you can underline the keywords. So, Legionnaires' disease. Legionnaires' disease is a type of pneumonia, lung infection, you get from breathing in Legionella bacteria. It can affect your lungs, brain, and gut, that is gastrointestinal tract. Most people don't get Legionnaires disease even if they have been around Legionella bacteria, but some people are more likely to get sick with the Legionella infection than others. You have an increased risk of getting Legionnaires disease if you are older than 50. Smoke or smoking cigarettes, I mean if you're a smoker, have a weakened immune system, and certain medical conditions like HIV, diabetes, cancer and kidney or liver disease, and medications can compromise your immune system. Then have a long-term respiratory illness such as chronic obstructive pulmonary disease or emphysema, have had surgery requiring anesthesia recently. So these are my keywords from the text. First text. Then text B. അതുപോലെ തന്നെ ശ്രദ്ധിക്കേണ്ട കാര്യം, in text A the most part അല്ലെങ്കിൽ കൂടുതൽ സ്റ്റുഡൻസ് പറയുന്ന ഒരു കാര്യം എന്ന് പറയുന്നത് we are not getting enough time. എങ്ങനെ enough time കിട്ടുന്നത്? We are not doing the things properly. ഓക്കെ, ഒരു മെറ്റീരിയൽ അങ്ങ് കിട്ടി കഴിയുമ്പോഴത്തേക്കും നിങ്ങൾക്ക് ഭയങ്കര ഒരു എന്താ പറയുക ടെൻഷനാണ്. എന്തിനാണ് അങ്ങനെ ടെൻഷൻ അടിക്കുന്നത്? ബിക്കോസ് വി ആർ ദ പേഴ്സൺസ്, നമ്മളാണ് അറ്റ് ദി എൻഡ് ഓഫ് ദ ഡേ വി ഷുഡ് റൈറ്റ് ദി എക്സാം. നോബഡി ഈസ് ഗോണ റൈറ്റ് യുവർ എക്സാം. വേറെ ആരും വന്ന് എക്സാം എഴുതാൻ പോകുന്നില്ല. സോ വൈ യു ഗൈസ് ആർ ടെൻസ്ഡ്? ഓക്കെ, സോ വാട്ട് എവർ വി ആർ ഡൂയിങ് അറ്റ് ദി എൻഡ് ഓഫ് ദ ഡേ ദാറ്റ് മാറ്റേഴ്സ്. നമ്മൾ എന്താണോ ചെയ്യുന്നത് അതാണ് ഇമ്പോർട്ടൻറ്റ്. സോ ഫോക്കസ് ഓൺ ദാറ്റ്, ഇംപ്രൂവ് അവർ സെൽസ്. ഓക്കെ, ടെൻഷൻ അടിച്ചിരുന്നാൽ അവസാനം വരെ അത് മാത്രമേ സംഭവിക്കുകയുള്ളൂ. നോ ഇംപ്രൂവ്മെൻറ്റ് വിൽ ബി ദെയർ. സോ പ്ലീസ് ജസ്റ്റ് get out of that, I mean come out of this comfort zone and please do the things correctly. കറക്റ്റായിട്ട് സ്ട്രാറ്റജി ഒക്കെ പഠിച്ച് അതുപോലെ ചെയ്യുക. ഓക്കെ, then text B. Legionnaires, it is not Legionnaires, it is Legionnaires disease causes pneumonia-like symptoms that start 2 to 14 days after exposure to Legionella. You may also have neurological and gastrointestinal symptoms. You can get Legionnaires disease by breathing in mist, aerosolized water contaminated with bacteria, or from getting contaminated water in your lungs or respirating. Then symptoms of Legionnaires disease include fever, cough, and shortness of breath, then diarrhea, muscle aches, headache, nausea, confusion, coughing up blood, that is hemoptysis, and stomach abdominal pain. So these are the symptoms which they include. And text C is all about diagnosis. Blood test is there. Your provider will take blood from your arm with a needle. Your healthcare provider will look for signs of Legionella in your blood. They can also be used blood test to understand how well your organs are working. Then imaging test is there, which is X-ray or CT scan. Your provider will use a machine to take pictures of your lungs. They can use these images to look for changes in your lungs like pneumonia. Then bronchoscopy is there. Your provider make a thin lighted tube to look at the inside of your lungs. They will take samples, be tested for signs of Legionella. Then thoracentesis is there. You may need to have fluid drained from the outside of your lungs, that is pleural space. Your provider will test this fluid or signs of Legionella. Then we have a table. So you can expect maybe a table, I mean a pictorial in one of the text. Like a table ആണ് therapeutic options for adult patients with severe pneumonia from Legionella pneumophila mentioned. Therapy, it is macrolides, then fluoroquinolones, then rifampin, doxycycline, combinations, corticosteroids. So a lot of things mentioned and a lot of numbers. Azithromycin 500 mg IV every 24 hours, then clarithromycin 500 mg IV. A lot of medical terms mentioned here, name of the medicine and the measurement. I mean, yeah. So that's all about those things. Here there are comments mentioned. Preferred regimen in most setting of a fluoroquinolone, and generally well tolerated and effective. Then multiple drug interactions, warfarin, opiates, cyclosporin, antiretroviral, then protease inhibitors used with macrolide and quinolone. So limited clinical experience shows activity, no clear evidence of efficacy. Combination therapy compared to monotherapy, SCAP abbreviation. Yeah, monotherapy. So clinical evidence benefit at the present in patients with SCAP from Legionellosis awaiting clinical trial evidence. Yeah, these are my keywords from text D. A lot of numbers here. Now we are gonna read. അപ്പോൾ നമുക്ക് എത്ര മിനിറ്റ് കിട്ടും? You will get 2 minutes for skimming and scanning these 4 text. 4 മിനിറ്റ് വെച്ചിട്ട് സ്കിം ആൻഡ് സ്കാൻ ചെയ്യുക. ഈ 2 minutes വെച്ചിട്ട് സ്കിം ആൻഡ് സ്കാൻ ചെയ്യുക in the 4 text. So you have 4 different texts here and you can do skimming and scanning within this 2 minutes. അത് കഴിഞ്ഞിട്ടില്ലെങ്കിൽ കഴിയണ്ട. That is 2 minutes your time. Set that time. Okay. Then read legionaries. This is. So very clearly they have mentioned in the first this particular instruction that for each question 1 to 7, decide which text the information comes from. You may use any letter more than once. In which text can you find the information about? So that means you can write here A anengil A ennu B anengil B, C or T. Whatever it is, you can write there. So that's that. First question. Appam answers akka comment cheya. If it is right, definitely you guys are improving. If it is wrong, as I already mentioned, study, find out where is the mistake. Endukondu mistake vannu, why that mistake happened. Okay. First one, what are the methods for recognizing unusual changes occurring in the lungs? So my keywords, methods, unusual, lungs. So these are my keywords from the first question. Let me know in the comment box what is your answer. എന്തായിരിക്കും ആൻസർ വരാം? എന്താ നിങ്ങളുടെ ആൻസർ ഒന്ന് കമൻറ്റ് ചെയ്യാമോ? യെസ് റീനു, യെസ് വിഷ്ണു, ആര്യ. വെരി ഗുഡ് ദീപ, എക്സലൻറ്റ് ഡിയർ, ഗുഡ് ജോബ്. വാട്ട് അബൌട്ട് അതേഴ്സ്? ഫസ്റ്റ് ക്വസ്റ്റ്യൻ, what are the methods for recognizing unusual changes occurring in the lungs? അതായത് സിംപ്ലി സെയിങ് നമ്മൾ യൂസ് ചെയ്യുന്ന കുറച്ച് മെത്തേഡ്സ് എന്തൊക്കെയാണ്, എന്തിനാണ്? ടു ഐഡൻറ്റിഫൈ ദ ചേഞ്ചസ് ഓക്കറിങ് ഇൻ ദ ലങ്സ്. സോ വാട്ട് എവർ ഹാപ്പനിങ്, നമ്മൾ ഓൾറെഡി പറയുന്നുണ്ട് അവർ, ദിസ് ഇസ് കംപ്ലീറ്റ്ലി റിലേറ്റഡ് ടു ന്യൂമോണിയ വിച്ച് ഇസ് ഹാപ്പനിങ് ടു യുവർ ലങ്സ്. സോ ത്രൂ ദീസ് മെത്തേഡ് വി ക്യാൻ ഐഡൻറ്റിഫൈ ദ ചേഞ്ചസ് ഇൻ ദ ലങ്സ്. അപ്പോൾ ലങ്സിലുള്ള ചേഞ്ചസ് ഇങ്ങനെ ഐഡൻറ്റിഫൈ ചെയ്യുന്നതാണ് പറയുന്നത്. And where is it mentioned? Very good. Jess, Jarina, Arya, Santwana. Answer is mentioned in C. C is the right answer. Text is C. So in text C, as you can see here, a lot of diagnosis methods mentioned here. A lot of tests. Different tests. So especially as you can see here, bronchoscopy and thoracentesis. These are, every methods. Blood test, anangulum, imaging test, bronchoscopy, thoracentesis. That is mentioned in C. Second one. So right answer, yes, Antuna, Arya, Jarina, Fazila, Vishnu, Deepa, Akila. Very good. Second one, conditions that may cause harm to the immune system are, so my keywords, conditions, harm, immune system. So where is immune system mentioned and it can cause harm to the immune system? Let me know in the comment box. Conditions and immune system, harm. No idea. Any guess? Yeah, very good, Vishnu. Okay, Vishnu, answer is in text A. So that answer is A. And as you can see in text A, here, have weakened immune system. That is, it is affecting the immune system. Certain medical conditions, say the HIV, diabetes, cancer, kidney or liver disease. So these are the conditions which can affect your immune system. So answer is A. A is the right answer. Yes, Deepa, Jarina, Santwana. Very good, very good. Answer is yes, Akila. Third one, factors that indicates the ongoing of Legionnaires' disease. So keywords, factors, indicates, ongoing. Indicators indicates, which means that those, what are the symptoms which you can see. So what are the things or what are the symptoms which you can see in Legionnaires' disease? Okay, so where are symptoms mentioned here? Yes, Arya. Second one is A. Very good, dear. What about third question? Factors that indicates, what are the symptoms? Simply that is it. അപ്പോൾ എവിടെയാണ് സിംറ്റംസ് മെൻഷൻ ചെയ്യുന്നത്? They have mentioned the symptoms simply in B. Very good, Agila. That is in B. And you can see here in B a lot of factors or symptoms, indicators mentioned, a lot of symptoms. So simply answer is B. Fourth one, what demographic is at the highest risk of contracting Legionnaires' disease? So demographic, highest and risk. Demographic, which means a part of the population or people. So that is demographic here, which means, so where is population or part of the population mentioned? എവിടെയാണ് population പറ്റിയൊക്കെ പറയുന്നത്? Yes, Antwana, Deepa, Zila, Jarina, Vishnu. It's from B. Third one is from B. What about fourth one? Demographic, high risk. These people are population, part of the population. ഇതൊക്കെ എവിടെയെങ്കിലും പറഞ്ഞിട്ടുണ്ടോ? Anywhere mentioned? So that answer is yes. Very good, Deepa. Answer is A. And here, see the second para. From the second para itself, it's all about the demographic features. Most people, part of the population. Kanda. So simply, I can say answer is from A. Then fifth one, what advantages do blood tests offer besides detection of condition-related markers? So keywords, advantages, blood test, detection. Okay, so yes, Vishnu, Santwana, Jarina, Fazila, Deepa, fourth one is A. Very good. What about fifth question? Advantages, blood test. Of course, blood test is mentioned in text is C. And the advantage of the test is mentioned here. They can also be used to blood test to understand how well your organs are working. So, yeah, of course, the answer is in C. Sixth one. Yes, Vishnu, Akila. Yes, Gul. Your name is Gul Siddiq, right? I'm so sorry if it is wrong. Yeah, anyway, Siddiq. So, Siddiq, Vishnu. Yeah. So, what about this one? Fifth one, it is C. Yes, Jarina, Santwana, Deepa, Vasila, Vishnu, Akila. Yeah, that's right. Sixth one, significant pathways through which the bacteria can enter the body, human body. So, significant bacteria, human body. And the name of the bacteria is Legionella bacteria or something, yeah? I remember that. Anywhere, where is it mentioned? Pathways through which the bacteria can enter the body, and it's through some kind of a water, a mist. Yeah, I remember those kind of words somewhere. Yeah, here, Kanda. You can get Legionnaires disease by breathing in mist, aerolized water, contaminated bacteria, or with from getting contaminated water in your lungs. Yeah, that's aspirating. So, simply answer is B. B is the right answer. Okay, Sharon. Please include part B and part C in the future. Of course, I'll think about it. Okay, if you guys really need part B and part C, let's do that for sure. Okay. Yes. And you are the only person, I think, who wants part B and part C, right? What about others? I can see a lot of messages for sure. I'm just simply saying, okay, you're not the only person. A lot of requests are there. So we are thinking about providing part B and part C. Definitely we will think about it. Yeah, part B is also here. Always, every day. Okay. I'll consider that. Anyway, so seventh one, what medication has not demonstrated its effectiveness in enhancing SCAP in Legionnaires disease? So medication, then not, and SCAP. The word SCAP is only mentioned in text D. So, very simply, without even checking, we know that it's from D. Alle? Yes. So, what about 8 out of 8? Sorry, 7 out of 7? Anyone with 7 out of 7 for this part? 1 to 7 set of questions. 7 out of 7 or എത്ര പേരുണ്ട്? കണ്ടോ? So with the help of keywords, I understood the answers. I find out the answers. എനിക്ക് ആ keywords ആണ് ആൻസർ കണ്ടുപിടിക്കുന്നത്. അല്ല, അങ്ങനെയാണ് ഞാൻ കണ്ടുപിടിക്കുന്നത്. So please do underline the keywords always. ചിലപ്പോൾ നമുക്ക് keywords ഒന്നും underline ചെയ്ത ആൻസർ കിട്ടും. It's very rare. But majority of the time, you will not get the right answer if you're not underlining the keywords. So please do underline that. Eighth one. So we are just jumping to the eighth question. In what manner do the bacteria enter the body when an individual inhales mist? So mist, I know it's mentioned in B. Then what manner, that method, bacteria. So bacteria, manner, mist, it's mentioned in text B. So what method, how it is entering the body? Yes, Antona, Deepa, Fasila, it's 6. Why? What happened? Next time, please do understand where is the mistake, and okay, you can get 7 out of 7. Yes, Jarina, again 6. Okay, next time, 7 out of 7. Yes, Ankila, Santuna, very good, dear. All right. So, eighth one, in what manner do the bacteria enter the body when an individual inhales mist? So, manner, bacteria, mist. And where is it mentioned, this kind of things? Manner, bacteria. And I think it's mentioned in text B. You can get Legionnaires disease by breathing in mist, aerolize the water, contaminated with bacteria. So, through what? And it's through water. What water? It is aerolized water. So, answer is aerolized water. That is the right answer from B. Okay, so this is the right answer. Once again, I'll show you the answer. It's in the bracket. So brackets are important, remember? Okay. Ninth one. No, of course not. It's not the method. See, breathing is not a method. It's water. Through water, you can get the bacteria. Right? So answer is it is aerolized water. Yeah. Then ninth one. How often azithromycin 500 mg should be administered? And I know answer is from D because medicine's name is mentioned in D. And here the azithromycin is mentioned. So what is how often? They're asking the frequency. എത്ര പ്രാവശ്യമാണ് 500 mg IV every 24 hours. So answer is every 24 hours. That is the right answer. Every 24 hours. Ano? Yes. Yes, Vishnu. Very good, dear. Yes, Sudha. It is aerolized water. What about ninth one? Do you guys know the answer? That is every 24 hours. Don't write ingana edanda because it is not mentioned, only H mentioned there. So you can write every 24 hours. Okay, every 24 H. Yeah. 10th one. The exterior part of the lungs from which a certain fluid extracted and evaluated for evidences. So which is that part? Extracted, evaluated. Exterior part. Exterior part of the lung, I think it is mentioned in, I've seen that word in C, right? Somewhere here. Any idea, guys? Exterior part. Ivada, see, hours ആണെന്ന് we know that, you know that, but they are not mentioned full form here. But only they've mentioned H. Kando, hours ningane edithitilla. They've not written here it is hours. It is only H mentioned here. So please do write whatever it is mentioned in the passage, okay? Yeah, it's better. So what is that? Very good, Vishnu. Your answer is right. Absolutely. Answer is plural space. And the answer is mentioned in text is C. Yeah. See, you may need to have fluid drain from the outside of other part A, which is that part of the body. I mean, lungs, that is plural space. So answer is plural space. That is the right answer. So sorry others, it's not your answers. It is actually Vishnu's answer is right, plural space. 11th one. How long does it typically take for symptoms to appear after an individual has been exposed to these specific bacteria? So how long? Again, duration they are asking. But not frequency, duration. Typically take for symptoms. Symptoms mentioned in B, right? Appear after an individual has been exposed to these specific bacteria. So how long? Symptoms, bacteria. And I think it's from B. Yeah. Let me know in the comment box your answer. Yes, Antana, very good, dear. It is plural space. What about next one? 11th one. What is the duration? What is the duration? Yes, Akila, it's plural space. So that is mentioned in text to be. The duration is in the first line itself. Legionnaires disease causes pneumonia-like symptoms to start 2 to 14 days. After is mentioned there, exposure is there. So everything, bacteria is mentioned there. So answer is 2 to 14 days. That is the right answer. Then 12th one. Among the medications, which is considered to be well endured and fruitful? So medications, endured, fruitful. Endured, which means something tolerable. Okay, and fruitful, something usable. That's fruitful. So medications, endured, and fruitful. Yes, Fasila, Jarina, Vishnu, Deepa, Santwana, it is 2 to 14 days. Yes, yes. 12th one, where is tolerable, medication, something mentioned? Tolerable mentioned. Medications mentioned in text, I know that. But which medication is tolerable medication? Yeah, generally well tolerated and effective, useful. So that is fruitful. So that medicine is either fluoroquinolones. Okay, that is the right answer. This is the answer. Okay, next one. 13th one. What is the medical procedure in which specialists employ a slender illuminated tube to examine the interior of the lungs? So medical procedure, employ a slender. Where is slender mentioned? Yeah, slender, whatever. So what is the medical procedure? Medical procedures and the text mentioned in C. So let's see. Blood test. In blood test, they are using a needle. Imaging scan, that's they're just taking the pictures. Bronchoscopy, it's all about lighted tube to look inside of your lungs. And thoracentesis, I think it's bronchoscopy, right? Your provider may use a thin, lighted tube to look at the inside. Yeah, that's it. Slender. Yeah, right answer. So answer is bronchoscopy. Yes, Vishnu, very good dear. Answer is bronchoscopy. Yes, Akila, Santwana, Deepa, right answer. Yes, Jarina, it's bronchoscopy. So answer is bronchoscopy. Then 14th one, at what age and beyond are individuals are more susceptible falling victim to the disease? So even without looking, I know the answer. I think it's 50. I don't know whether that is, I should check, but I know 50 is there. Yeah, older than 50. But don't write older than 50 because instead of older than, in the question already they've mentioned beyond, more than. So don't write older than. Answer is just 50. Sorry, Vishnu. No. Because instead of older than, I'll already here they've mentioned beyond that age. So beyond that age, more than that age. That's older than. So answer is just 50 is the right answer. Very good, Deepa. Your answer is right. Yes, Vasila, it is 50. So that's that. Then 15th one, when contrasted with a dash, there is no apparent indication of increased effectiveness in combination therapy. So no indication, combination. So combination therapy is mentioned in D. And no apparent indication. So what is that about? Combination therapy is here. Any guess? Maybe here will be the answer or here is the answer. I think answer is... Oh, something has happened. Yeah, I think answer is here. Because no clear evidence, that means no indications of efficacy of combination therapy keyword compared with monotherapy. So that I think answer is monotherapy, right? Very good, Vishnu. Answer is monotherapy from D. That is monotherapy. No indication, combination. Yes, Jarina. Very good, Akila. Yes, that is monotherapy. Fasila, it's not monotherapy, it's monotherapy. Otta word or not. Don't separate the words. Definitely you will not get the mark. Okay, when you write a single word, it should be single. Monotherapy, single word. It's not a separated word. Okay. 16th one, a dash is used to take blood samples and subsequently analyzed for indications of Legionella. Blood samples, indications, Legionella. Blood sample എടുക്കാൻ യൂസ് ചെയ്യുന്നത് already we know that's needle, right? I don't know whether it is right or wrong from text C. I'm just guessing. Your provider will take blood from your arm with a needle. Yeah, of course. Yes, it is needle. We are using a needle there. Yes, Vishnu, very good. That is a needle. Yes, Deepa, the previous one is monotherapy. Yes, Antwana, right answer. Then next one is 17. The patient may present with a condition called dash where coughing up of blood takes place. Condition, present, coughing up. Where is it mentioned? Coughing up, symptoms mentioned in B. But that is symptom with coughing. Fever is not that. Cough is there usually dry, but not name is mentioned there. Shortness of breath, dyspnea. Then coughing up blood. Yeah, this is the key exact word. So answer is hemoptysis. H-E-M-O, hemo, which means blood. Then hemoptysis. Okay, coughing up blood. Then 18th one, emphysema and COPD are some persistent dash that stands as important risk factors for the development of Legionnaires' disease. Emphysema, COPD, then risk. These are the keywords. Okay, so answer is yes. Yes, Jarina, Sneha, Deepa, Vishnu. Yes, Vishnu. Yes, that is the right answer. And what about 18th one? Emphysema, COPD, risk. 18th one. Yeah, very good. Respiratory illness. Respiratory illness mentioned in text A. And here have a long respiratory illness such as chronic obstructive pulmonary disease or emphysema. So instead of that one, they have mentioned emphysema here. So answer is long-term respiratory illness. Second last one, the symptoms of Legionnaires' disease resembles that of dash and also have a brain and gut symptoms. So Legionnaires symptoms, brain, gut. I think it's mentioned in A. I'm not sure because I've seen it here, gut and brain. Yeah, brain, gut. That is gastrointestinal tract, right? Oh, no. No. Or pneumonia, lung infection. What is that one? Let me know in the comment box whether it is gastrointestinal tract or pneumonia. Very good. Yes, Vishnu, that is pneumonia. Yeah. Yes. That is the right answer, which is pneumonia. That is here. That is the lung infection that is affecting your brain and gut. So that is pneumonia. And the last question, the person who had the habit of dash in the past might have the chance to get affected from Legionnaires' disease. So person, habit, and chance. Okay, so where is that one mentioned? This is not directly mentioned. You should think with your common sense here. On the 20th one. Because of what situation? Because of your, not situation, what is of, your habit. Because of what habit, in the habit there is a chance for getting this condition. What is the habit mentioned? I will not say the answer. You guys say the answer. Yeah. Any idea? Because of habit. What habit? In the habit. What habit? Yes, Akila, your answer is right. Smoke cigarette is actually what you are doing. I mean, that particular thing. That is a cigarette. But what is a habit called? Yeah. No. It's not that. Not smoke cigarettes. What is the habit called? Of course not. That is smoking. That is the habit, right? Smoke cigarette and cigarette is a good kind of thing. And if you have the habit, that's called smoking is the habit. Here smoking. And that's from text A. It is mentioned smoke or used to smoke cigarette. That habit is called smoking habit. So smoking is the right answer. Okay. That's that. Okay. So that's all about today. I think it was a super helpful session for you. So take care. Happy weekend. Thank you.